Salams and welcome. Thank you for joining me in part 5 of breast cancer awareness. And we're looking at the absolute basics of breast cancer. And my mission is just simply to raise awareness about breast cancer. And like many other conditions in the medical field, one, we have the lesson that prevention is better than cure. And secondly, the earlier a diagnosis is made about cancer, the better the outcome. And there's absolute no doubt about that. And this has been proven over and over again, where in first world nations or in wealthier nations, who have put much resources insofar as breast screening is concerned, then the earlier the breast cancer is detected, the much better is the outcome compared to South Africa or the African continent or in the Middle East like Afghanistan or Pakistan or other areas of the world where diagnosis is made much later. Many patients come in with advanced stage 4 cancer, and then it is mainly just palliative care because nothing much can be done about it. And in some cultures, there's also a sense of shame that this is a very private matter and no one needs to know. And some mothers or women who have breast cancer, they don't even want to tell anyone about it, and they suffer in silence with this. It's a very sad situation, right? So let's look at some of the statistics, breast cancer basics, right? In general, with very, very wide approximations, please remember these are just general figures because we are just referring to back to basics, right? In general, with very wide approximations, the average 5-year survival of breast cancer in first world countries is about 90%, right? 80 to 90%, very, very good survival rate, and much lower in developing and third world nations, right? So once again, it depends on which country you're living in, and it all depends on the resources, right? But the outcome is fairly, very, very good in general. It all depends if the patient has got other comorbidities. That means, does the patient have other illnesses together with the cancer? And it depends on the age of the patient and the nutritional status of the patient, among many other things. So worldwide, breast cancer is the leading type of cancer in women, accounting for 25% of all cases. In 2018, it resulted in 2 million new cases and more than 600,000 deaths. It is more common in developed countries, and the reason why it is more common in developed countries is because it is picked up much earlier. They have much more advances, more mammogram screening, more MRI machines, so because they are very good at picking it up, that's why the number there is high. It does not mean that it is not high in developing nations. In fact, in developing nations, it's just as high, but we are not picking it up because of limited resources. And for us in South Africa, the two main cancers, Mensa, please listen to this, the two main cancers affecting our people in women are breast cancer and cervical cancer. And if you're on the highway anytime in the Johannesburg area or anywhere else throughout the country, you'll look at huge billboards talking about the HPV vaccine. Now, the HPV is the human papilloma virus, and that can lead to breast cancer in young females. At least the cervical cancer in young females, right? And cervical cancer occurs at that young age because young girls are having sex at a very young age without any condoms or without any other types of protection. And to prevent this type of, there is a very effective vaccine known as the HPV vaccine, and this is given to young girls from the age of 9 years before they reach the age of puberty. And sadly, we find in our country, because of a combination of poverty and other types of problems, we find even young schoolgirls not only having sex with the other schoolmates, but also having sex with their teachers so that they can get better marks at school and they can pass their exams. And this becomes very sad because if this continues, then they catch the HPV virus, the human papilloma virus, and they spread it to other people. And this then becomes quite common, and especially it's more devastating in patients who also have a combination with HIV/AIDS. So many countries around the world, or some organizations, are even going back to religious values and are urging youngsters to stay away from sex, and that premarital sex should be avoided altogether, and you should wait for the time that you are married. So this depends on the religious leaders, but this is quite a concerning issue with in South Africa or in the African continent. Studies have showed, I don't know if I've got it in this particular article, but studies have showed elsewhere that out of the 20 countries in the world, the top 20 countries in the world which have the highest rate of cervical cancer, 18 of those countries are in the African continent. Is because our young girls are having sex without condoms, or they're having sex at a young age from 10 years, 11 years, 12 years, and within a 5 years time, 6 years time, 15 and 16-year-old girls or 21-year-old girls are being diagnosed with cancer. Can you imagine a 19-year-old girl or a 21-year-old girl being diagnosed with cancer or HIV AIDS? And I've spoken to some of my doctor colleagues, and they say it's very sad to see young, beautiful girls walking into the surgery, into the examination room. Young 19-year-old or 21-year-old or 22-year-old, and they got HIV/AIDS or they got cervical cancer based on the Pap smear. Very, very sad, and this is because of promiscuity, is because of starting sex from a young age, and there's no doubt about it that sex at a young age will lead to cancer. So please, this is an awareness campaign. Please, each family and each child must make their own decision. For us as Muslims, we know, and even for Christians, as far as the Christian values are concerned, and insofar as the Islamic or the Muslim values are concerned, premarital sex is not allowed and extramarital sex is not allowed. You must remember that you need a license for everything. If you want to drive a car, you need a driving license. If you want to use a gun, you need a gun license. If you want to have sex, you need a sex license. And the license for sex is your marriage certificate. Right. So let's continue. In 2022, there were approximately 2.3 million new cases of breast cancer diagnosed worldwide. Breast cancer is most commonly diagnosed cancer in women globally, and the second most common following lung cancer. In 2022, breast cancer accounted for 11 to 12% of all new cancer diagnoses globally. On the other hand, every year, breast cancer accounts for about 30% of all new cancers in America because of better vigilance, screening, and healthcare. All right? Cancers are detected much earlier than in other nations because America is very advanced and they spent a lot of resources in screening and healthcare, and because many Hollywood celebrities, whether it's Angelina Jolie, all the various types of celebrities, and I've got a separate program on the celebrities who are speaking out about cancer, and they make their voices very vocal, and the government then invests a lot of money in cancer better screening, because the celebrities are also telling us that the earlier the diagnosis, the better the outcome. So while breast cancer occurs in women of all ages after puberty, the incidence increases with age. There are significant disparities in breast cancer incidence worldwide and mortality rates. Right? Breast cancer is a leading cause of death among women globally. In 2022, nearly 700,000 deaths from breast cancer worldwide. Remember, breast cancer can also occur in men, although it is much rarer. In 2022, 25,000 men were diagnosed with breast cancer. About 16% of women are younger than 50 years of age, and more than 60% of breast cancer are diagnosed at a localized stage before it is spread. In 2025, approximately 42,000 women will die from breast cancer. And please remember, this is very important. A woman's risk of breast cancer nearly doubles if she has a first-degree relative, for example, mother, sister, or daughter, who has been diagnosed with breast cancer. Stay well, look after yourself, and please ensure that you go for a mammogram as early as possible. Alhamdulillah Rabbil Alameen.